This conference will now be recorded.
Hello everyone, I am Dr. Juma Bishas. I am one of the mentor of MRCOG Health, and today I will going to discuss one of the important topic of urogynecology, and you know that is very important for your part 2 and part 3, that is bladder diary. So before going to discuss about the bladder diary, we should know that what is bladder diary. So it's a chart to record the times urine passes and the volumes voided over a period of 3 to 7 days. Usually 3 days is used, completed by the patient. That means it's a chart that must be filled up by the patient for minimum 3 days and maximum 7 days. And they should write down the time they passes urine and volume they voided. So that included in the bladder diary. So it helps us to make a number of things like when and how much fluid patient drink. So they should also include the amount of fluid they are taking and the types of fluid they are taking, and when and how much they urinate. That means how many times they need to go to toilet and the amount of the urine passes, and how often she has that got a go urgency feeling, that whether if anytime they're feeling any kind of urgency, or they should write down also in the bladder diary, and when and how much urine she may leak. That means that anytime she leak and how much amount she leak, they should also include in bladder diary. So if we see this bladder diary, it's a chart, and here it's time. So they should complete it for 3 days and for maximum 7 days, and they should fill up. When they start to fill up, they should complete it for 24 hours is the main issue. And when they got out from the bed, they should write down the time, and they should start this bladder diary fill up. So regarding the drinks, they should write down that's the how much amount the fluid they are taking and what kind of fluid they are taking. You know that on an average, they should take 1.5 to 2 liter of fluids, and you know that the intake and output must be equal. So you have to calculate that also. So that means that output also should be 1.5 to 2 liter. And the type of fluid is important because that's you know that some of the fluids can irritate the bladder, like if anyone taking too much of caffeine or tea or alcohol, that can irritate bladder, that can provoke the bladder problem. So that's helps us to guide that what type of fluid they are taking, of if they are taking any kind of excessive amount of tea or coffee, that we can advise them to reduce that. So that's why the drinking type and amount is very important. So next one is that the amount of their urine passes, and that how many times they need to go toilet. Usually at during daytime they should pass urine for 7 times. At night they should pass at least 3 times. So if it is more than that, that means if it is more than 3 times at night, that indicate patient is suffering from nocturia. Or in daytime or nighttime, if it is more than the normal range, that indicate the frequency. So for to understand that things, that's why the times of urine passes is important, and amount of urine is important. As I told you, the intake and output should be equal, that is it should be 1.5 to 2 liter. So another thing is, if any kind of leakage they are facing, and the amount of leakage, it's also very important, and whether it is associated with any urge to pass urine, to differentiate it from the urge stress incontinence, to understand that whether it is associated with any kind of urge incontinence, to rule out that, we have to fill up that also. And also whether this leak type of leakage, whether it is associated with any kind of sneezing, any kind of coughing, or during sexual intercourse, they should write down that also. So it's actually give an idea about that whether it is a bladder problem, whether it is a say a stress incontinence, whether it is an overactive bladder, or whether it's a combination of stress and urge incontinence, so that it can give an idea about that how we can manage the case. Okay, so this is the importance of bladder diary. So if we see the importance of bladder diary in short, so we can see that it's give a useful tool to track the bladder behavior. That means whether the bladder behaves normally, whether the bladder behaves abnormally, to differentiate that, and what type of abnormal behavior the bladder is doing, we also can understand from bladder diary, like whether it's a stress urinary incontinence, whether it's a overactive bladder, whether it is a combination of stress and overactive. When in case of mixed urinary incontinence, which symptoms are predominant, we can also understand from bladder diary, so that it can give an idea about how we can start the treatment. So that's why the bladder diary is very, very important. And it's also important to decide that's how we can treat the incontinence. Like if it's guide that is a case of overactive bladder, we can treat on that way. If it's a case of incontinence, we can treat the case on that way. And if it is a combination of both, then we can see that which symptoms is predominant and we must treat the predominant symptom. That's why the bladder diary is very, very important. It gives us a way how we can treat the case easily. Okay, so it's also used as a reference when setting the filling rate in cystometry. You know that if patient is not responding to any general treatment like lifestyle modifications, in case of overactive bladder, if they are not responding with medication, so what we can do, that we need to do a urodynamic study. And urodynamic study divided into the two part. One is the cystometry and one is the uroflowmetry. So in case of cystometry, this bladder diary, we can use it as a reference when setting the filling rate in cystometry. In the cystometry, there's a two phase. One is the filling rate, one is the um, that is passing rate, that is the urine, the amount of urine they are passing, that is uroflow rate. Okay. So how do we use the bladder diary? So to begin to write down this bladder diary, so they should start it when they wake up at each day, and they should note it throughout the day and continue until she complete 24 hours. This is very important. When they start to write down the or fill up the bladder diary, they should complete it for 24 hours. For example, if she wakes up at 7 a.m. on the first day of her diary, take notes until 7 a.m. on the next day. So it's very, very, very important to fill up the bladder diary for 24 hours, and they should fill up for minimum 3 days and maximum 7 days. And they should write down the amount of their taking fluids and what type of fluid they are taking, whether they are taking any kind of plain water or juice or coffee or wine. They should write them in here, and they should write down when and how much they urinate both during the day and night. Doctor often provide a special measuring collection device to use. It's a measuring jug. Doctor can provide them to this measuring jug to the patient, so that when they pass urine, they can pass urine in this measuring jug to calculate the amount of urine they are passing. And it's best to keep a diary for at least 3 days. I already told you they should keep maintain this bladder diary for minimum 7 days and maximum 3 days. Minimum 3 days and maximum 7 days they should complete it. So it's an important one we should inform to the patient, and they should bring this bladder diary on their next visit, so that you can get an idea about that, so what type of problem they're facing and which one is predominant one, and whether we can give any kind of treatment to reduce the symptoms. So next one is the normal values. I already told you that intake should be 1.5 to 2 liter, and intake must be equal to the output, that is 1.5 to 2 liter. Frequency during daytime, it's at least up to 7 times, and at night up to 3 times. If it is more than that, it indicate nocturia, and if it is more than of this normal range, that it indicate frequency, and the volume per void should be 300 to 400 ml. So I already discussed this one, that they should start it from when they got up from the bed, and they write down the time, and they should complete it for 24 hours. And they should write down the amount of fluid they are taking and the type of fluid they are taking, and that how much they pass urine and how many times they need to go to the toilets, whether there is any kind of leakage, whether it is associated with any kind of overactive bladder, or whether it is associated with any kind of sneezing, coughing, exercising, or even during in the sexual intercourse. They should write down this one. Okay, so let's see one bladder diary. It's completed by one patient, so we can see it. They start to this bladder diary from 8 a.m. and it's not completed, they should complete it for the next 8 a.m. That means for the 24 hours, where we can see that they're taking too much of coffee. You can see she's too taking too much of tea, coffee, and at evening, that's while they're at night, they're taking beers and wines. So that indicates she's taking too much of caffeine and alcohol. That indicates it's one of the factors that can irritate the bladder. And if we advise them to reduce that amount of tea, coffee, and they should avoid taking alcohol and tea, coffee after evening. So that can help them to reduce their symptoms. So that means it's one of the provocating factor for their bladder problem. So here we can see that in here it's you can see that there is an amount of urine they are passing that is only about 60 ml, and there is a leak. That means only when there is only a small amount of urine into the bladder, that irritate the bladder, and patient need to urge to pass urine, and there is a leak. That indicate there is an urge incontinence, because the first sensation to desire void, that should be 150 to 300 ml. So if it is less than that, that indicate there is a urge incontinence. Okay, so here also you can see only the 100 ml patient, there is a leak, that indicate that it's an urge incontinence. And somewhere you can see that there is no passing of urine, but there is a leak, that indicate it's a case of stress urinary incontinence. Like when she's doing any kind of exercising or coughing or sneezing, there is a leak. So you can see there is one leak like this, and there's another leak in here, and there's another leak. So it's a case of mixed urinary incontinence. That means it's a combination of overactive bladder and stress urinary incontinence. So how we can advise them or how it can help us to guide the treatment? So first we advise them to do some lifestyle modification, like they should change their amount of fluid taking, the type of fluid they are taking. They should cut down the tea, coffee, and they should avoid taking alcohol after evening. That can help them to reduce their symptoms. So you can see that this is the way the bladder diary give us an idea about the type of urinary incontinence, and they also give us idea about the treatment options. So it's another bladder diary. You can see patients start to write down it from 7 a.m. up to 6 a.m. That means it's a complete form of the bladder diary. They complete it for 24 hours. And you can see there's an intake. There's an in a, day one, it's day two, and day three. It's an intake, it's an output, and it's a leak. It's here the amount of fluid or type of fluid is not included here. So we only can give you an idea about that what type of incontinence it's here. Only this chart can show. So here you can see it's 150 ml, and there's a weight. I already told you that the first sensation to desire void should be 150 ml to and then the maximum sensation should be 300 to 500 ml. So here you can see only in the 150 ml there is a leak, that indicates an urge incontinence. And even you can see in 100 ml of urine they pass, there is an wet, so that indicates an urge incontinence. And there is a 200 ml the urine pass, and there is a wet, that indicate it's an urge urinary incontinence. So here you can see in the day two, you can see there's no urine output, but there's a leak, that indicate it's associated with stress urinary incontinence, like when patient doing any kind of coughing, sneezing, or any kind of passing urine, that like during sexual intercourse, there is a leak. And you can see here there is only 100 ml they pass, there is a leak, that indicates urge urinary incontinence. And there is no urine output, but there is a leak, that indicates stress urinary incontinence. And in the day 3 you can see there is only 100 ml of urine they out, and there is a leak. 200 ml there is a leak, 160 ml there is a leak, 100 ml there is a leak. Actually the first sensation to desire to void, if any woman have a first sensation, so if any kind of first sensation and they need to urge to go to the toilet, otherwise there is a leak, that indicate an urge incontinence. So if any woman less than 300 ml, if any kind of urge to pass urine and there is a leak, that indicates an urge urinary incontinence. If anytime you can see that there is no output, but there is a leak, that indicates it's a stress urinary incontinence. Okay, so it's also a combination of stress and overactive bladder or urge incontinence. Okay, so I think I can give you a small idea about the bladder diary. It's very important in urogynecology to understand about the bladder behavior. Bladder diary is very, very important. We advise them to fill up its for at least 3 days, and when they start to fill up this bladder diary, they should complete it for at least 24 hours so that we can get an idea about the type of fluid they are taking, amount of fluid they are taking, and the amount of urine they passes, and how many times they need to pass urine, and whether there is any kind of leak, and if there is any kind of leak, whether it is associated with any urge to pass urine, or whether it is associated with any kind of stress like coughing, sneezing, or even during sexual intercourse. So thank you all for listening this bladder diary. I think it will help you to understand about the bladder diary. You can give information about the bladder diary to the patient, and it helps you for your exam. And I also request you to subscribe our channel so that you can get updated that video we are published in our web channel. You can update it with that. So thank you. Bye.